Good evening, everyone. Um, Thank you so much for being here. My name is Michelle Storms. My pronouns are she, her, they, them. I'm the executive director at the ACLU of Washington. Before I get started this evening, I want to acknowledge that I'm speaking to you from the traditional homelands of the Coast Salish people. Our office in downtown Seattle sits on the unceded territory of the Duwamish people. Our work throughout the entire state of Washington spans many Indigenous territories, and we acknowledge all First People of our region who have and continue to steward this land since time immemorial. We express our gratitude as guests and thank the original and current stewards of this land. I encourage you to learn more about the land you are on. There will be a link in the chat that shows you more. And there's a powerful animation on the scale and severity of land loss. You can check out the next link in the chat. Understand that the loss of land is more severe than just a place to live. It's loss of culture, language, traditional ways of being. And as we seek to work against white supremacy and settler colonialism, we must always remember the role our country played in the forced removal of lands, cultures, and languages, and recognize the way we continue to perpetuate colonization today, and as we also seek to repair harms that have been done. I know that you all appreciate that land acknowledgements are just a starting point for learning what we need to do and the actions we need to take. And we need to demonstrate that we understand and are willing to do the work necessary to make this country truly fair and just. Another thing I need to acknowledge today is that we're gathering amidst the news of more tragedy, more violence. Our hearts are with the victims in Uvalde, Texas, their families, and their entire community hurting from the horrific attack with the school shooting that occurred today. People, children no less, should be able to go freely about their daily lives without the threat of violence. In the midst of us already processing the racially motivated shooting tragedy in Buffalo, the shooting at the Taiwanese church that followed that, we must continue to work toward a world where everyone can lead their lives without fear of violence. Nevertheless, our hearts are very heavy for far too many reasons. So before I begin our actual business today, I have a couple quick logistical things. As you all know, because many of you have been here before, our Flights and Rights events are typically hosted in breweries and event spaces around the state, and most often the gathering space at KEXP 90.3 FM, kexp.org. They've been an important partner for us over the years, even continuing now. And everyone in attendance tonight, as usual, has entered in our swag giveaway, the prize package including swag by Indigenous artist Emma Noyes and a set of KEXP and ACLU koozies to keep your drink cold. We'll draw names after the event and notify 3 lucky winners by email in the coming week. Also, please know, as this program proceeds, if you have any questions at any point, please use the Q&A box, and post-event we'll send you a list of links and resources that we've mentioned throughout the talk. So now let me get into it, because tonight we're going to talk about the future of abortion. Now, as you likely well know, Politico published a leaked draft of the Supreme Court's majority opinion overturning Roe versus Wade. Now, while the Supreme Court has confirmed that the draft is authentic, it is important to remember it's not final. And it's also really important to remember this, that right now abortion is a right and Roe is still the law of the land. Now, we expect the Supreme Court to make a decision in the coming weeks on this case, the Mississippi case Dobbs versus Jackson Women's Health Organization, that has the potential to either limit abortion rights protections established under Roe or overturn the landmark decision altogether. If Roe is overturned, 26 states could move to ban abortion, and 36 million women and other people who can become pregnant could lose abortion access. So before we dive into tonight's conversation, I want to share an overview of abortion access in this country, and that has led us to this point today. So one thing that many don't know is that in early US history, abortion was widely available. Drugs to induce abortion were advertised in newspapers, could be bought from pharmacists, physicians, even through the mail. And of course, patients could visit practitioners for care. And it wasn't actually until the 1880s that abortion became more of a political issue. And this had to do with a couple of different things. One of them was growing pressure from medical institutions even including the American Medical Association, which of course now is an advocate for abortion. Back then, the desire to put midwives and homeopaths out of business, also coinciding with a time when women were seeking to go to medical school to become obstetricians, well, it became something of a backlash against women. But that's not the only thing that was happening. Abortions, birth control, and general efforts to manage the timing of pregnancy and family planning meant that birth rates, and we're still in the 1880s now, among white women were falling at the same time that more immigrants were entering the United States. There were not the non-Protestant immigrants, people coming from China, and of course there were all of these happenings at the same time. And we can't deny the link between nativism and white supremacy and the anti-abortion efforts. Historian Leslie Reagan cites that anti-abortion activists were at that time largely white men, and that white male patriotism demanded that maternity be enforced among white Protestant women. And that's a direct quote. And when you take a moment to let that sink in and think of the implications of it, then and now. And so while the fight around abortion is often focused on women, we also know it's not just cisgender women that need abortions, but also trans men, gender non-binary individuals, and others. So attacks on abortion are attacks on all of us. And even after abortions became illegal, of course, again, starting from the 1880s up until Roe versus Wade, people continued to have them. They just weren't advertised the same way. Practitioners did their work behind closed doors or private homes. And unfortunately, people without money sought out the back alley procedures that you've known so much about, taking matters in their own hands with knitting needles and coat hangers, drinking chemicals, or douching with lye. These methods resulted in medical emergencies and in many cases death, and underground abortion services rose up to try to save lives. So with the passage of Roe versus Wade in 1973, the US Supreme Court legalized abortions in this country, creating the right to seek abortion before fetus viability, which made a huge difference across this country in the lives of so many people. And while a right doesn't guarantee access, it still put in place a way for people to begin to have autonomy over their own bodies. So let's quickly talk about the Dobbs case, because I do want to get to our brilliant panelists. In 2018, the Center for Reproductive Rights filed the Dobbs versus Jackson Women's Health Organization, which is the last, get this, the last remaining abortion clinic in the entire state of Mississippi. So they had filed a response to the state's unconstitutional ban on abortion after 15 weeks of pregnancy, which is a direct defiance of Roe versus Wade. So this Mississippi 15-week ban did have exceptions, or does have exceptions for medical emergencies or severe fetal abnormality, but no exception for rape or incest. The federal district and appellate courts in Mississippi blocked enforcement of this unconstitutional ban, and they upheld Roe versus Wade. And then the state of Mississippi took it to the United States Supreme Court to review the 15-week ban. And remembering that under Roe, we're talking about viability, which is 24 weeks plus. So the court agreed to consider the question as to whether all pre-viability prohibitions on abortion are unconstitutional. They heard arguments last December. We've seen the leaked decision, and now we're awaiting the final decision, which most certainly will happen sometime this month. So what next and what now? Here to talk about the implications in Washington State are some marvelous advocates that I'm so proud for us to have. So I'm going to tell you who each of them are, and then we're just going to get into some questions. First, we have Dr. Erin Berry. Erin is an OBGYN physician who specializes in complex family planning and abortion care. They currently serve as the Washington Medical Director and Director of Research for Planned Parenthood of the Great Northwest, Hawaii, Alaska, Indiana, Kentucky. Erin currently provides in-person and virtual abortion care in Washington, Oregon, and Idaho. Erin went to medical school at OHSU in Portland, Oregon, and completed an OBGYN residency, and has a Master's of Public Health and Complex Family Planning Fellowship at Emory University in Atlanta, Georgia. Next, I'm pleased to introduce Kia Guarino. Kia is the Executive Director of Pro-Choice Washington, the leading grassroots advocacy organization for reproductive freedom in Washington. Kia brings more than a decade of experience advancing reproductive health, gender equity, policy change, and public health across the globe and here at home. Kia has a master's in international health systems and international development economics from Hopkins and believes deeply in the power of this movement. I'm also excited to have Miranda Vargas joining us. Miranda is the owner and practitioner of Heaton's Garden, a sexual wellness practice designed to guide people of color, especially women, non-binary, and queer folks, to access pleasure, providing one-to-one coaching sessions and group workshops. Miranda is one of the board directors for the Northwest Abortion Access Fund and serves as a practical support volunteer on the hotline. In 2016, Miranda completed her Master's of Public Health from the University of Washington Community-Oriented Public Health Practice Program. Last but not least is my own colleague, Leah Rutman, who you've heard from before. Leah is Healthcare and Liberty Counsel at the ACLU of Washington. In this role, Leah works to expand and protect health access, rights, and equity. Prior to joining the ACLU in 2013, Leah practiced commercial litigation at an international law firm and worked and volunteered at various human rights organizations. Leah is a graduate of McGill University and Columbia University School of Law, and outside of work can be found exploring Seattle beaches and spending time with her kids. These brilliant people have so much to share with you, so I'm going to begin, and I'm going to begin with Leah, because the big question that everybody wants to know the answer to is, if Roe is overturned, what does that mean for the legal right to abortion in Washington state and across the country? Thank you, Leah.
Thank you, and it's so nice to be here with everyone tonight. I have lost my voice a little, so I'm so sorry if I am a little quiet. Hopefully you can all hear me. Normally, when I'm giving one of these talks, there is a silver lining I can focus on. There isn't a great one tonight, but we're going to do what we can. If the Supreme Court overturns Roe versus Wade and Planned Parenthood versus Casey, we will see the US turned into a patchwork of abortion access, with 26 states posed to quickly make abortion illegal, inaccessible, and unsafe. To go into detail on that a little, 9 states already have abortion bans in place. They just haven't been enforced since Roe was decided, so those automatically come back into effect. 13 states have trigger laws, which means they will go into effect within 30 days, really, after Roe is overturned, to make abortion illegal. And 4 states have gone that extra step and passed constitutional amendments declaring their constitution does not protect or require a right to abortion. And even without overturning Roe, let's be honest, around the country, states are introducing and passing bills that ban abortion and put providers and patients at risk. These bills are already decimating abortion access right now and have a disproportionate impact on marginalized people. The prime example that everyone talks about, obviously, is Texas's SB 8 law, which now has copycats across the country. It created a bounty system that allows private citizens to sue abortion providers and anyone who assists a pregnant person with accessing abortion, be it an Uber driver, your friend who lends you money to get an abortion. And it makes abortion illegal at 6 weeks of pregnancy before many people even know they are pregnant. This already means that in Texas, abortion access is next to nothing. It is gone. Even our neighbor in Idaho has already passed a similar law. It is stayed right now due to litigation, but the legislature passed it and the governor signed it. In Washington, we are so lucky that pregnant people who choose an abortion will continue to have that right, even if the Supreme Court overturns Roe. The Reproductive Privacy Act, which passed by voter initiative in 1991, guarantees the fundamental right to choose an abortion. However, I want to be really explicit about this. The right to choose an abortion does not guarantee access to it. For example, many health systems around our state refuse to let their doctors or nurses provide abortion care, even though they are trained to do it and willing to do it. We also have seen over and over again disparities in who can access care. In our state, we are going to have to do so much more in the legislature and otherwise to protect and expand abortion access for patients in Washington and those who are going to be coming here to our state to seek care. Thanks.
Well, that's a good start. It's a sobering start. And actually, I feel like you gave a natural segue for us to turn over to Erin if Erin is ready, because you're a provider. Are you able to, or should I skip over you for now?
Just got over school. Sorry.
Okay. Okay. So
I'm good.
as a
Got it now.
Okay, so as a provider, right, in Washington, Oregon, and Idaho, can you tell us what you're seeing on the ground right now and what you expect abortion provision to be looking like in these states that you work in over the upcoming months?
Yeah, I mean, so I think we already live in a world in which access to abortion varies greatly depending on where you live and your zip code. So we already are experiencing a little bit of a preview of what's to come. And why I highlight that is that I regularly see patients from Texas right now in Washington and actually in Idaho, which, the projections when they talk about, oh, patients are traveling this far from Texas and all this stuff, is that most people are going to nearby states. But the reality is there's a lot of people who live in Texas who need abortion and need reproductive health care, and they go to where is safe and comfortable for them if they can. So a lot of people have family here, and so they're flying, and we're seeing them. They're staying with family, staying with a sister, staying with a friend who is supportive. So we're seeing a lot of that. I see people from Texas, and we recently saw some people from Oklahoma too. So it's happening actually almost every day that we're seeing out of state people already in Washington. And that we're talking now, that's 2 states, So it is really easy to imagine what, in that sense, what we're going to see. And it's people traveling really far distances, people who can traveling really far distances, jumping through really substantial hoops that not everyone is going to make it through to get their services in Washington and regionally in Oregon and California too. And so, in a way I can see what it's going to look like, right? And we're seeing these patients that had to take red eyes to come get here, are away from their family and support system, going through this alone or semi-alone away from their home, and the sort of extra burden that patients are faced with doing that, facing this feeling a lot more alone. So the burden that placed on them, but also on abortion clinic staff who, are great support systems, but are taking on even that much more. And we are seeing that, and we are trying to do our best to focus on our staff to help us talk about the emotional roller coaster that are going on already and are about to go on even more. So I think we're all sort of bracing ourselves a little bit, and feeling okay, we kind of get it, but in reality, I think that we also have these moments of like, we don't really know what's coming. It's so hard to fathom for a lot of us. What does this really mean for 36 million people to not have access to this, who have previously had not the easiest time in the world, but much more local access. And so, I think as an OBGYN, I also, there's so many different elements to it, but I also worry about the more severe cases and the complications that are going to happen, and starting to see more of that. And it is just a reality of what's going to happen. I already personally have seen one patient who flew here from Texas, and when she got here, I diagnosed her with a pretty late ectopic. And she delayed getting care in Texas because she didn't think it was an ectopic, right? And so she flew across and had to get surgery here in the Northwest for her ectopic that, she could have got at home if she had felt comfortable accessing care at home. But I've already seen this. It's already happening. And now we're about to multiply that times 26 states. And it's overwhelming, it's sad. It makes me mad and disappointed. But I think overall there's a lot of grief that's happening right now for patients and for people who dedicate their lives to this work. And I think we always, we're so used to fighting these little battles in the courts and little, there, how many bans has Idaho passed? There's so many, that get enjoined and do this, and it's all this back and forth. But in the end, we always kind of get to do it. In the end, it's sort of, okay, we end up usually getting to provide care. We have to kind of, new barriers are created or new rules are made that we have to kind of hop over, but we're able to hop over them and provide access to the people who need it. And then Texas happened, and then this is happening. And now it's like, oh, we're not going to be able to get over this barrier right now. We're going to have to stop care for people. And that's just really intense.
I really appreciate you speaking to like just the grief and the emotion, because I think since the case came down, like everybody's been in hyperdrive. What does it mean? What are we going to do? What are the implications beyond, like just so many different things. And so I really appreciate you mentioning the feelings, not only of pregnant people who are scared, but also providers. There's something else that you touched on too, though, that I want to follow up on, if you don't mind, because you mentioned about the one person with the ectopic pregnancy. And one of the things that people have been really trying to elevate in the mind of the public is that abortion is a part of healthcare. And I feel like you as an OB/GYN can really uniquely speak to that. And I'm just kind of asking you, can you say something about that and just really help people understand, like, this is not some radical thing. It's a part of your health. And so if you have anything you can say about that, I'd love to hear it.
Abortion is an essential part of reproductive health care. It's an essential part of pregnancy care, because pregnancy is this complex thing that happens. And as we know, it's not perfect. The medical care that we provide to treat pregnancies and things that can go wrong and things that go well, it's all connected. Abortion is a very vital and crucial part of that. And sometimes the line between, abortion and miscarriage management and desired pregnancy is very blurred. It's not black and white. There's a lot of gray in there. And when you try and legislate things into black and white that aren't black and white, it leaves a lot of people extremely vulnerable and a lot of room for danger and misinterpretation of I'm going to take this gray thing. Do I have to put that in the black or the white? I don't know. And people make wrong decisions, like people, going to ERs with miscarriage symptoms and things like that. And so there's just a lot of fear amongst a lot of the practitioners of pregnancy related care right now, is, the harm that this is going to place on basically everyone who has a pregnancy. It's not isolated to this like subset of abortion care and people who have abortions, as if they're this distinct separate category of people when they're really not. They're, yeah.
You expressed that very beautifully, and I really appreciate it. And again, I think the stress on the healthcare system against a backdrop of further barriers to abortion care is going to be extreme. So both you and Leah mentioned the distinction between rights and access. And I want to go to Miranda now, because the whole thing about access often has to do with money. It has always been the case before Roe, post Roe, whatever. When you have money, it's a lot easier to get the full range of care that you need. And when you don't, it's very hard. So abortion funds are pretty essential to access for many people, but a lot of people don't even know what abortion access funds are or that they exist. So I would love, Miranda, if you could tell us a little bit about what abortion funds are and what they do, and about the work of the Northwest Abortion Access Fund specifically.
Sure. Thanks for having me. Yeah, so for those who don't know, an abortion fund is an organization. It's a group of people who have come together to literally fund abortion. So we have a hotline. At NOAF, we serve the Northwest, which means Washington, Oregon, Idaho, and Alaska. So primarily those are where our callers are coming from, with the majority actually calling from Idaho as well. But we serve folks who come from all over the country as well. We work with other funds who are doing the similar work across the country. Anyway, so an abortion fund, people call our hotline. They either need help funding their actual abortion procedure, or they need help traveling to and from that appointment. So we have relationships with clinics in all 4 of our states that we pay directly and on behalf of the caller who is seeking an abortion. And then for my part, so I'm a practical support volunteer, I work with folks to book flights, hotels, arrange homestays, rides to and from their appointments, if they need childcare, ordering groceries while they're staying in their hotel, things like that. Really trying to reduce the amount of barriers that people have to accessing abortion that we've already heard impact so many already, and will potentially impact another huge group of people. And the other thing that I was thinking too, while y'all were talking, was it's definitely very important to think about these 26 states that are going to be greatly impacted by the fall of Roe. And, you know, NWAF has been around for 30 plus years. People have always needed access to abortion and by always, I mean in the last 100 years, clearly. Thank you for sharing that history, Michelle. So for a long time, people have needed access to abortion, and we've been there to help. And even thinking about rural Washington, you know, folks in Eastern Washington, more often it's easier for them to travel to Idaho to get abortions just because of proximity. So that is also going to change for folks in our very own state. So I would imagine similar things are also going to be happening in states maybe where the risk of abortion is not there, or abortion restrictions is not quite there, but their personal access to abortion is going to be greatly reduced. Yeah, I could go on and on. So I don't know if you want me to talk about more, Michelle, or if you have another specific question.
Well, so that was all right on target. How do people access your fund?
Yes. So we have a hotline number, which I will actually, if you wouldn't mind sharing it in the chat, that might actually be really helpful.
Yeah, we've got it.
And awesome. Yeah, so people call that number, they leave a voicemail. Our funding advocates get back to people, do an intake, and we are able to communicate by phone, text, email, whatever feels best for people, whatever's safest for them. And yeah, then things unroll from there. And since we are just giving straight up money to clinics or paying for travel arrangements and things, we rely heavily on donations for our funding. So 60% of our spending budget comes from individuals donating money. We just had our annual fundraiser month in April called Fundathon. Our website is still up. That specific fundraising page is still up. And you can donate at our website, nwafund.org. If you are interested in helping us be able to continue to fund our callers. As you can imagine, there's been a huge interest in volunteership since the leak happened. And if that is of interest to you, definitely fill out our volunteer interest form as well. It might just take a little while to get back to you. Our coordinator is going through every single application, but yeah, it's just taking a minute. So just know that. But donations are always, always, always super important. And it is honestly right now one of the best things you can do to help this situation.
Yeah. Thank you so much for what you're doing there and for letting us know. And we've definitely elevated all those resources in the chat, and we'll follow
Thank
up by
you.
email with those for folks afterwards as well so that they can remember. I want to turn to Kia now, and with everything that's going on around in the country, can you talk a little bit about what you think needs to happen at the state level to help increase access to abortion care?
Yeah, absolutely. Thank you, Michelle, and to everyone. Just beautifully said so far on such an emotionally draining topic. So thank you all. I will actually, I think, start with doubling down on what Miranda just shared. I'm going to focus at it from a individual power perspective, because I think even though there are very few silver linings, but there are still some. We haven't lost access in Washington state yet, and we haven't lost it nationally either, but we still have a moment in which to harness sort of the people power behind this work. And one of the main ways to do that is to resource this work. And I think the Pacific Northwest is often considered sort of a wealthy, progressive haven. Even within the movement, there's often an assumption that it's well funded, well resourced, well supported. That's really not true. A lot of this work is so highly dependent on individual donations and support for these organizations that have been working at the community level for a long time. We're also 90% reliant on individual gifts every year. And so really thinking about your power through your resources is a strong activist pathway. So we like to encourage people to remember that donating to candidates that are progressive, to organizations that are doing that work, is activism, and it's super powerful in this moment, especially when we're tempted to do something about this. There are people who've been doing this work for a long time, like MAF, of course. I highly recommend funding them, our independent clinics and providers, folks who are on the ground doing this work. I think another way is to vote. I'm sure we're all tired of hearing that, and our democracy has left quite a bit to be desired in the last several years in particular. And yet we are in this really important moment in Washington state where we still have influence and power, and protecting our right to vote and our right to participate in civic society is essential, especially as we see the efforts to roll back our basic rights that are taking place. So showing up this November is really critical. And in Washington state, we have about 87% of our seats up for re-election across the House and the Senate. And I want to emphasize 87%, and the fact that we've seen trends towards more conservative candidates, including very concerning far-right candidates that are highly resourced and have already been out there providing really damaging misinformation in key races. So really paying attention to not only the individual races that are in your area, but also the overall trends, where we're not doing the best job in supporting and electing social justice champions of color. We have to keep doing that, because our protection of abortion rights are only as secure as the current state legislature. And until we lose that, as we've seen in other states, we still have a chance to protect those rights here. So vote. Participate in our electoral action work. We'll have a link in the chat, but we work with activists and train them. No experience is required to be out in the streets, door knocking phones, really getting out for candidates who are representing the possibility of a future in which these rights remain protected. And I think the second part of that is really continuing to push for legislation that addresses the holes in our safety net in Washington. You've heard this several times already tonight, that just because we have legal protection here, that absolutely does not mean that access is guaranteed. When you look at the map of our state, we have most clinics east of the Cascades that do not provide or cannot provide post 12-week care. Some do. We've heard already that there are hospitals that prevent providers from giving care on a pretty wide basis. About 50% of hospital beds in Washington state are under those restrictions. So looking at our state, we still have a lot of work to do to plug those holes as we prepare for what Dr. Berry shared so eloquently, which is an unexpected or unknown influx of patients that we're going to need to provide care for, including for those that are already falling through our network already. And then finally, I want to talk about changing the narrative, which I think is a really powerful part of the work that we still need to do. And it's a long game. All of this is also a long game, but it's something to do now that has to happen now in order for us to address any or have any hope of really addressing the trends that we're seeing now. So Michelle beautifully shared the intersection between white nationalist agendas and far right agendas. And there is definitely an intersection in the way that the anti-abortion movement has spoken about abortion for a very long time and has created the structures and the misinformation that has allowed abortion to be sidelined and considered this sort of extremist feminist issue that is not central to healthcare and the pregnancy experience, which of course it is, and is not, supported by the vast majority of the population, which of course it is. And so by creating the conversations that normalize abortion, that counter the misinformation around what it means to have abortion as part of our healthcare system, that moves away from the fear and violence narrative that has been a really big part of how this work has been spoken about. It's a really powerful way to take back the power of this movement and to demonstrate that we are actually the majority, and the majority movement is about love and support and trust. And that is super powerful. And so that's my big push. And we have in the chat, you'll see, we just published a How to Talk About Abortion guide, which is some pretty practical tools about how to change the way we speak about this work to give it the power that it needs. So I'll stop there.
Thank you, Kia. All of that is so great. And I especially appreciate the narrative and the offering up of the guide, right? I think, yes, I just think yes to all of what you said. So I'm going to go to Erin for a question, and then I'm going to circle back. I'm teeing you up, Leah, for a question from the audience. And so Dr. Berry, I want to ask you this. Again, from the provider perspective, what do you see as the most important things that need to be done in states like Washington, where we are better equipped, right, to improve abortion access and to protect patients and providers?
It's a big question. I think, supporting, so it's a really challenging time in healthcare right now. All of us are coming off 2 years of pandemic, which has been extremely hard because financially, just because it's been expensive to run a healthcare organization right now, and diminished patient volumes, and actually most of where my clinics get our funding and pay our salaries is from patient care. That's sort of how we keep our doors open, is by seeing patients, which is not which includes all of the patients that we see. And it's really hard to right now, because coming off the pandemic, and then coming off 4 years of a Trump presidency where we lost Title X funding and all kinds of stuff. And so Washington as a state has been amazing to actually help support some abortion providers, and starting to sort of fill in the gaps and help support people to sort of keep our clinics open, to keep them staffed. So we are fortunate to live in a state who is helping with that. And so continued, but these are sort of one-time little funding efforts and one-time things. And so because this is a long game, like we've been referencing, that has to sort of be written into what we do as a state, is to help make sure that, funding is there to keep NWAF going, to keep our clinics open, so that we can actually feasibly be here in the modern sort of healthcare, state that we are in, which is a challenging one, right? And so supporting, family planning and sexual and reproductive health in our legislature in a long term is crucial, and that includes, everyone connected to clinics. And I just want to say that NWAF is, everyone on this call is amazing. And the impact that NWAF has on my individual patients is huge. And so I just can't emphasize that enough, actually. We have patients, especially because, I do a lot of my clinics are in Seattle, although I work all over. And so some patients in the region have to come sometimes from Alaska, from Idaho, flying in, to Seattle to get the care because they need care and sort of higher level care for whatever reason, multiple different reasons, right? And NWAF helps, people traveling from really far distances, small villages in remote Alaska, to get them the care that they need, and really helps in so many other ways too. So just thank you all for the work that you do, because it is a community of people here working to get everyone the care that they need in the region. And I think that in the long game, we need to kind of continue with that regional approach, because again, we're going to live in this patchwork of divided states. And it's going to be really hard, but I think we have to live in community and show love to each other and care and bring people to the places where they need to go to get the healthcare, the basic human right of healthcare that they need. Focusing on making sure that people actually, we have the rights in Washington, but making sure that people actually can get here and have the access is crucial. And I feel like that's a little bit that, what that actually means is going to ebb and flow a little bit, but funding is crucial.
Really appreciate your reflections and also all that you're doing. And Leah, there was a question. Well, I'm going to throw two things in at once that are there, Leah, if you don't mind. One was about what legislation are you aiming for? Constitutional amendments, like what is some of the advocacy work that you're focused on? And then also there was a question about Medicaid in Washington. If Roe versus Wade was overturned, would Medicaid in Washington stop covering abortion?
Yes, happy to answer those questions. They're both really good ones. And in talking about, what we're looking at here right now, one of the great things about being with this group on this call talking about this is these are the same organizations we are working with every single day on these issues. I'm just really grateful in Washington State at a time like this that we have such close allies and partners that we're all working together to figure out solutions, because it's not easy right now. As a first priority, as you've been hearing tonight, is funding, figuring out what to do to ensure there is funding for uncompensated care, for QT BIPOC organizations that need it right now, for training, everything. Oregon passed $50 million in a reproductive equity fund their past legislative session. The New York governor just mentioned $35 million in an abortion fund. We have to do something here. We're just going to need that funding. Separate from that, we need to protect our patients and our providers. Some of you may have seen that last week, the Attorney General came out with a letter to try to ensure that doctors would not be, and other medical professionals would not have any issues getting medical licenses here because of lawsuits in other states relating to providing abortion or gender affirming care that would be legal if performed here. This is so essential to provide these protections, and I would argue we probably need something legislatively to ensure that providers have the protections they need. Other states are looking at this and other protections, and we are currently exploring all those relating to extradition, relating to others. Separately, I think we need to work on just improving access generally. There was a bill last session that Planned Parenthood led on, which increased access, HB 1851, and Dr. Berry may have more to speak to it, to ensure that there is a greater number of providers in our state who are able to provide care. But we need to do more because, as we've been talking about, there isn't enough. We need to be looking at, should there be stipends or scholarships provided to ensure that providers are able to work in areas where there are fewer providers, where there are more disparities in care. There's just so much work that needs to be done. And I'm really looking forward in some ways to this legislative session where we can put forward a comprehensive proposal of what we can do to improve care in the state, both for the patients in it and for the many, many people we're going to see coming in. And I think the separate question that I heard was, is it possible that if Roe versus Wade is overturned, Medicaid in Washington would stop covering abortion? So it's a great question. And I think what we need to really get out there as much as possible is, even if Roe versus Wade is overturned, for now, the law of our land, of Washington State, is abortion is still legal. Abortions can still be covered under Medicaid. It has not become illegal at the federal level. It is just left for the states to determine how they want things to go. And so in Washington State, there would both still be access to abortion and there should still be Medicaid coverage for abortion.
Thank you so much. And honestly, Leah, we just have to keep saying that early and often, because at least as to what we've understood about this case so far is that states would still determine. That's why we're so worried about those 26 states that are poised to ban abortion right now. But Washington is not one of those states, and abortion will remain legal in Washington state. Dr. Berry, I saw you go off mute, so I felt like maybe you wanted to add something to that.
Yeah, I guess I want to just add to the importance of states who are, states of reproductive choice, is the importance of sort of modernizing how we deal with telehealth and telehealth care, because we have a really huge ability to provide excellent high quality teleabortion and post-abortion care and pre-abortion counseling via telehealth. The biggest issue right now is we just don't get you don't get paid for it. It's hard. There's a lot of problems with that. And that's with all actually telehealth right now. There's just, we don't have a very modernized system and we're trying to catch up with the pandemic and stuff. But I think that's something actually Washington state and some supportive states could really help, because, and that is sort of the future of looking at, how do we actually provide real access through all the avenues that we have, which includes virtual care.
Yeah, that's a powerful addendum, right? To think about, like, how do we do more virtual care, fund that, support that. I want to turn to Miranda again and just ask, how is your organization looking forward and planning forward what we know are going to be increased numbers of people needing the support of the Abortion Access Fund?
Yeah, this is a discussion we've been having since the beginning of the year, really. So the NOAF is, we have 3 staff members, and then there's 16 board members. And so we're primarily a working board. So we're pretty much managing everything that isn't related to programs. So we do a lot of the strategizing and strategic planning and things like that. So yeah, the main thing that we have really been trying to double down on is our fundraising game, and just trying to build as many community partnerships, legislative partnerships to leverage the work that we're doing and be a part of, states like Oregon and New York, allotting money for this work. I think we are definitely expecting, again, it's like, as Dr. Berry said, it's like this unknown number. We're expecting to have an influx of people from other states, seeking help and traveling to our region, which would, also is a criteria for us helping them out. So, yeah, we're bracing ourselves really for the impact, and just trying, and aside from that, also just trying to take care of ourselves and like be there for each other, and tend to our emotional strength as an organization and as individuals. It's a really trying time, especially for, a small organization that's, mostly volunteer led. So yeah, we're just trying to just brace ourselves and stay strong with among our relationships with each other too.
Thank you so much for that. And Dr. Berry said earlier about the importance of community and the importance of love. And so we definitely need to send a lot of love to you folks at, what do you say, NOAF? Is that how you say it? Okay, so definitely. So getting back in solution space again a little bit, Kia, I wanted to have you speak to this work you've been doing on pulling together and coordinating advocates around a regional abortion council. Could you tell us a little bit about what that is and what it would do and what you hope it will accomplish? And then if time permits, we're going to get just a little bit in from Leah about some of these impacts beyond abortion. But Kia, please talk about the Regional Abortion Council.
Yeah, and I think Miranda, you did a beautiful job talking about the regional elements of this, as did Dr. Berry. But I think the the more we get into this future landscape that we're expecting once the decision is final, the more it's very clear that while abortion rights will be protected through state and local policies, access is very regional. And the Northwest is often misunderstood from the rest of the country about what it actually looks like as for the complex dynamics and sort of unique political structures that it represents. And I think we have a really unique location where we have, large concentrations of wealth, highly progressive cities, the birthplace of modern white nationalism, rural communities, geographic structures, impacts of climate change, all these things that make it a really unique region, and making it really important to have conversations beyond just our state borders. And so this Access Coalition was really inspired in part by the work that came out of California, where they responded to the governor's statement of becoming a reproductive freedom state and created a coalition across the range of reproductive health care and access. And so, as you've heard a few times tonight, abortion is an element of the wide range of pregnancy and reproductive care that spans things like fertility treatments, gender affirming care. It's very wide ranging. And so access obviously has to be considered, not just about the abortion care itself, but what reproductive care access looks like. And also from the New England area, they likewise got together as a community in the region and talked about what access looks like for them as another sort of concentration of where safe haven opportunities will be once the final decision comes down and we're in that patchwork structure. So where abortion will still be protected for as long as we can keep it that way. So this coalition, the idea is to bring together organizations that span that wide spectrum of reproductive care to share information about what access looks like, what providers are experiencing, what regional abortion funds are experiencing, and making sure that when we make policy decisions at the local level or communications and narrative decisions at the local level, that it's being informed by this whole idea of access, and that we're actually creating a space to exchange information and to consolidate our power and our influence in this moment, and to sort of change that narrative and create the tools and structures at a whole regional level. Because again, that long game is not just protecting it in places like Washington, but also getting back to a place where spaces like Idaho and Alaska and Montana, who are facing some of those upcoming barriers, can drive change. And then, the structure will allow us to create that information from the bottom up and the top down, and really creating something that I think will be stronger and can learn from places like Oregon who have unlocked resources. So that's a high level.
That's fantastic. And thank you so much for doing that work. And I know we're participating in that too, but again, it's that solution space. Like, what are the things that we can do to strengthen services, to strengthen the community, and to work in a time that's otherwise a little bit dire in many ways, right? So I want to quickly hit a couple audience questions. And Miranda, there was a question as to whether your fund supports patients from outside the Northwest who want to come to Washington for abortion care.
Yes, definitely. Sometimes folks call our hotline directly, and other times they've called a fund that is local to them, and that fund has contacted us to help with kind of like co-funding that person. So just quickly, there is the National Network of Abortion Funds at the federal level, and NOAF is one of about 70 regional funds. So we're one of 70 funds across the country that are doing this work. So there's definitely a lot of interaction that we have with other groups as well, and definitely like bring folks here or help them leave the region as well if they need to go to like Boulder or Albuquerque. That's usually where we send folks for third try abortions. So.
Thank you.
100%.
And that's perfect. I'm so glad you mentioned that there is a national network, because that's what I was going to ask you to follow up on, that there's several of these organizations, and that I love that you all coordinate and collaborate with each other as well.
Mm-hmm.
And then another one, last audience question for the night, regarding medical abortions. The use of medication. Can medications be mailed into states prohibiting or restricting abortions? Leah, do you know something about that?
I do, but before I answer, I would actually, Dr. Berry, would you like to take that, as I'm sure, and then I can
Yeah, either one of you.
Oh
Yeah.
goodness. Yeah, I mean, we can tag team a little bit. So there are many states that are passing specific laws saying, that absolutely, that restricting medication abortion through the mail from anywhere. And then in specific bans as well, in addition, so the Idaho ban that's currently in Joint SB 1309 actually basically states that any medication causing an abortion can't be taken in the state. Or you can sue for it, actually, these sort of bounty like things, similar to Texas, but a little different. We don't have to get into it. But anyway, and so it calls out all the medications. So the mifepristone, misoprostol, calls them out by name and basically says, if you are in Idaho and you ingest this medication, you can be sued for it if you provided that. So it's a little bit, there's a lot of details, I would say, that are all kind of getting figured out in various laws. But I feel like probably in the end, the states that have the abortion ban, these same 26 states, it's going to end up that mailing medications to those states will not be allowed. So there's some complexity there, I think, but I think it's going to down to the fact that no, that isn't a legal viable option for people. Now, will people do this and self-source medications for self-source medication abortion? Absolutely, they already are, and they already do, and that can be actually a very safe way to have an abortion, and it can and will happen. The legality of that, though, in the States is another matter.
And that's pretty much what I expected to hear. And part of the problem is that when it's a state by state thing, it's a total patchwork. What's legal in Texas and what's legal in California and what's legal in Arkansas and what's legal in New York are going to be completely different things. It's going to be super confusing for people. But on this idea of what people are going to do anyway, there was actually a pretty interesting article in the Atlantic Monthly, I think last month, about the underground movement of abortion providers. So self-care, like people learning how to support each other in early term abortion, and all of a whole range of ways that just movements are coming back up. And you think Code Word Jane returning and like all these things, which is not what we want, but it also is a little bit of this again, solution-based innovation, creativity of how people will support each other for their actual healthcare. I know we're at about like 1 minute, but I do want to come back to Leah for this one thing, which is there's been a lot of conversation about, with this leak decision, that is obviously about Roe versus Wade, but what implications it might have for other rights. Because this decision says, oh, well, one of the reasons this privacy right, which is the basis of Roe versus Wade, right, is that privacy right isn't written into the Constitution and it's not enshrined in any laws or legislation, right? So therefore, it's not a valid constitutional right. But there's an awful lot of things that aren't in the Constitution. Same-sex marriage, interracial marriage, so many things. And so some people say, well, no, it's not going to be about that. But I'm asking Leah, what are the implications from your point of view?
This is my opportunity to nerd out with the law, which is great. Yeah, so it's a really interesting question. On one hand, you have the obvious sort of less legal analysis, which is just having, if this leak decision becomes law, it's going to embolden states to not just outlaw abortion, but also things like Plan B, right? And you already see attempts like this happening. But from sort of the legal analysis standpoint, just to go into a bit of the weeds, in the leak decision, Justice Alito is discussing how some rights are not explicitly mentioned in the Constitution, but are still found to be constitutional rights under the 14th Amendment. And how, though, that the only way you can find those rights under the 14th Amendment is if you can show it's deeply, deeply rooted in this nation's history and tradition. So, okay, fair, right? If you want to show that something's a constitutional right and it's not explicitly written in there, he's saying you have to show it's deeply rooted in the nation's history and tradition. But then he goes on to cite a variety of sources to find that the right to abortion is not deeply rooted in nation's history and tradition, and therefore Roe's wrongly decided. But there's two really important points here. You could look and say, is there a deep history and tradition when it comes to bodily autonomy, when it comes to privacy? I would argue yes. You could find a lot of sources that say yes. But instead, Justice Alito kept the question really, really narrow and chose his sources. He chose what he wanted. Michelle spent the first part of this talking about how there has been a right to abortion and that it wasn't outlawed for many years. But that's not what Justice Alito did. He said this really narrow question of, is there a right to abortion? Similarly, you might ask not, is there a right to marriage, but is there a long tradition and history of same-sex marriage? And therefore choose your sources very carefully in terms of what you choose to look at. Number two, based on the sources Alito was using, he was essentially saying that the only constitutional right you can have is if it was contemplated by white men in the 1800s. In making his argument, and one of the best examples I have of this is he referred to a 13th century treatise that designated abortion as homicide and relied on medical common law in which women were likened to chattel. And so, sure, I'm pretty sure the person who wrote that treatise was not seeing abortion as a right. I'm also pretty sure that's not what we want to be relying on in 2022. So this obviously, I would say, creates a whole host of concerns. It was infuriating in the decision that Justice Alito stated multiple times, this only affects abortion. It will not affect any other right because abortion is somehow so different than everything else. And it's infuriating because it is so obvious in reading his decision and reading these arguments that of course they could be applied to marriage. Of course they could be applied to other things. Will they be successful? I don't know, but the same arguments could absolutely be made.
Thank you for that. And so, part of what that says to me, and this is what the ACLU is all about anyway, right? It's like we have to be vigilant. We have to be vigilant for the rights of all of our siblings. We are at a point in our society where we understand that there's so much variety in race and ethnicity and sexual orientation and gender identity. And so these are things that we understand. In the 1300s, not so much, not because those things didn't exist and weren't present, but because the people who were in charge were making the rules. And so we have to be vigilant on behalf of those people who end up finding themselves in vulnerable and marginalized positions because they haven't been acknowledged. They haven't been acknowledged as belonging to the human family. Their identities haven't belonged. So we have work to do. I'm so grateful to each and every one of you for the work that you do, which is so compassionate and so deep and caring and so thoughtful and forward-looking. And I'll just say we have overcome hardships before in this country across many movements, and we're going to overcome them again because we have to on behalf of all of our people who have need of it. And especially when we work together, that's when we get somewhere. So I'm super grateful for the collaboration of all the people here and all that you do together. We're fighting for our rights. Going back is not an option. So 1,000 thanks to each of you for being here tonight, for the work you do in the community. And thank you for the people who came in to listen and ask really good questions and be thoughtful and be supportive. There's all these links in the chat. I really hope you will support these organizations that are doing this vital work, and come back next month and we'll talk about Pride. So stay tuned. Thanks everyone and have a great night.